do you think there are quality institutions and surgeons in other parts of the world that would hold up to this level of quality that we're talking about with the best U.S. organizations?
If not equal, sometimes even better.
But it's my pleasure to have time this day to speak with Dr. Jeff Dobro. I have known Jeff for many years and have the utmost respect for him as a consultant, as a business leader, and as a clinician. So, Jeff, welcome and thank you for giving us a few minutes of your time.
Dave, thanks so much. It's a pleasure to work with you again.
I'd like to start with maybe just give us a little bit of your background, what you've been working on over the last several years, and what your focus on these days.
Sure. Yeah. Thanks a lot. It's been really a life mission to bring quality, affordable care to everybody in the country. But why limit ourselves to the country? Really, we ought to be able to have high quality, affordable care available to everybody around the world, whether you're an expat living someplace else or an American citizen. That focus on the global citizens is something that's just not been successfully addressed by anybody in the over 30 years that I've been in this business. Having been the chief innovation officer at Transcarent or chief medical officer at One Medical, or a partner, with you at Willis Towers Watson and again at Mercer, thinking about how to bring creative, effective, and cost-effective solutions to employers and their people, whether it's the employees or their family members, have just been core to every project, every job that I've had since I've been in the healthcare field.
So I love and admire that passion, and that's always something that's been a special quality of yours. And it's an area of interest that I share immensely as well, as you know. Let's talk a little bit more about kind of the state of play with centers of excellence and strategies to adopt and to promote centers of excellence. Where do you see that these days with large employers?
So large employers have really adopted this concept of centers of excellence. They mostly focus on surgery for now, since it's a large part. It's almost a quarter of the total spend for a self-insured employer. So it's important to focus on procedures that there is variability, that you can measure quality. Patients or people are willing to go to these centers and are looking for access to high-quality centers wherever they live. So this has been a trend that I've seen evolving over at least the last maybe 7 or 8 years, where employers are picking up surgical centers of excellence. They're looking for cancer centers of excellence. Maybe it's now around weight management or bariatrics and centers of excellence there. There's a very high level of interest. And I naturally see this expanding beyond just the United States footprint into a global footprint.
Well, I was going to ask you that question next. So I'm sure in your experiences, you worked with many large global organizations, and the centers of excellence strategies that they deployed were probably focused on the U.S. market exclusively. Do you see an opportunity for that strategy to expand truly to many countries, and in situations where people might have a destination for a center of excellence that's outside of their country?
Absolutely. There are many different parts of the employee population that will be interested in having centers of excellence outside of the United States. I've worked with these large multinationals for decades, and the quality and access to care outside the U.S. just is not ever been solved. No one knows how to actually identify and then help direct their people to these centers. So whether, like we were talking about, whether it's an expat or even people in the U.S. that might be willing to go near offshore, whether it's to one of the islands or someplace in Canada, there are multiple opportunities, especially for that low wage population that just can't afford the large out of pockets that they have here in the U.S. We've talked a lot about different companies that are focused in the U.S. with large employers right now. So that particular service is being widely adopted. Clearly, there's a big opportunity to expand that to the global environment.
What would you think are some of the important considerations for a global employer take in the end as they consider expanding a COE strategy globally?
So there are a couple of things. Quality has got to be at the top of the list. First, no employer wants to help guide its members to a place that it doesn't feel confident will deliver quality care. And whether you're looking at surgery, where you have volumes and particular outcomes and certifications, reputation, that's really, really important. Getting data and being able to measure specific data from these organizations is going to be important. And then around quality, it's not just the institution, but the actual physicians that are within those institutions that are providing care. And then within that, it's a specific specialty. Like, are you going to operate on my shoulder? Because that's what you're good at. You may be a great shoulder orthopedist, maybe not so good on the knees or the hips. So getting down to that very granular level is incredibly important. And there is data to help measure whether somebody is specifically trained and doing the right volume and getting the right outcomes for those narrow sets of procedures. So that's going to be really important for organizations to be able to focus on. Access is really important. It'd be great if everybody in the world could go to the one best surgeon on that particular topic. It's not possible. So making sure that there's a wide enough array of providers who can offer these services, and they're specifically trained and specialize in just those. And then, of course, if you're a large employer, cost is incredibly important. High quality care is available in the US for US-based people, and it probably is around the world, except it's very costly. And that savings is going to be important for an employer to understand, and for any supplier in this COE space, it has to be able to prove that they've saved some money. Otherwise, why go through the effort of working with any organization that can provide a COE service? The last thing I would say is that organizations that are successful here also make it easier for the actual providers themselves, whether it's around the economics or collecting medical records or doing follow-up care and getting that coordinated service in place, so that really serves that quadruple aim of quality, cost, patient experience, and provider experience to them specifically.
You mentioned access as one of the key considerations and something that a good COE network would address. Maybe to share your thoughts on how a center of excellence model can actually facilitate greater access to the best, facilities and best surgeons, and perhaps how that impacts what might be significant wait times for people who would generally be looking to, undertake a non-emergency surgical procedure.
Sure. So from access, it is that timing is very important. We know in many countries, maybe you could get access to one of the best at the procedure you need, but you may have to wait 6 months. In some countries, maybe a year and a half, 2 years. In the meantime, that poor person is suffering from whatever the issue is that needs to be addressed. So timing is really important, and organizations that are going to be and are serving in the COE space have to have the kinds of agreements with these centers of excellence that their patients can get access in a very reasonable and short time period. Also, just the travel, to get to a center of excellence. You and I may think, oh, it's easy. We're just going to call up and make, our reservations. But it's really important for us as developers of this kind of a service to make sure that there's a concierge level, like white glove kind of service. Just make it easy for people. The average person is going to be worried, oh, am I going to get there? How am I going to get there? Who's going to hold my hand and walk me through this whole process? So who's going to do that for them? And then who's going to provide that other person, whether it's through phone or text or whatever the communication is, to answer questions, as questions will come up throughout the entire process. So that part is really important, that navigation, that concierge, that white glove level of service. And then the same thing at the back end in the follow-up. Who's going to coordinate all of this for me? The average person will have no idea how to actually do that. So this comprehensive access from a time perspective and that hand-holding perspective is critical to success.
Right. I'm going to pose sort of a maybe a bit of a pejorative question to you, and I know you'll take it in the spirit it's intended, right? What would you say to somebody who said, you know, why would anyone want to get healthcare outside of the U.S.? The best healthcare in the world is in the U.S. How would you respond to that?
First, I take it from a couple perspectives. One is if I was, let's say, a U.S. citizen and I'm now working in, you name the country, someplace that's not here. I want to get my care where I'm working. My family's here with me. I might not want to fly home. I also don't want to stop working. So how, if living someplace else other than my home base in the States, how am I ever going to find some provider to take care of me? On the flip side, if I'm a citizen of some other country and I happen to be working here in the US, I want to go home. I want to be with my family. I want the support. I want a place to recover that's comfortable to me and is actually culturally responsive to my needs. The way that you could pick any country, but the way that I want to be cared for based on the way I grew up may not be what happens here in the US. So I want to be I want to be in a place that's near home. I trust it. I know the food. I'm going to think of my own place. There's a lot to say for that level of comfort. And I also want to trust who's taking care of me, and that's highly related to where I've come from, where I'm going to be going, and that's not easy for somebody who's not actually in their home base to find.
What would you say to the quality of care in these countries, right? Say it's an individual of Indian origin who's working in the United States and wants to go back, to India for a particular procedure and to convalesce. Do you think there are quality institutions and surgeons in other parts of the world that would hold up to the sort of level of
Oh,
quality we're talking about with the best U.S. organization?
if not equal, sometimes even better. But here's one thing I would say, the variability of the outcomes and the quality of care, I think based on my global work so far, the variability is much greater outside the United States. You can find top quality institutions and doctors in bottom of the barrel. It's all over the place. So for an individual to have that comfort and that trust that they're going to the highest quality, that's the equivalent of any top quality institution here, is fantastic, and they need to have that. The other piece that I would say when I mentioned that some of the care is actually could be better outside the United States, if we take an example of, let's say, cardiac surgery, some of the institutions in India have so finely engineered the process of doing, let's say, valve replacements. They're done faster, better, the outcomes are better. And it's only recently that some of those techniques have been adopted at some of the best institutions here in the United States. So we're learning from the best around the world as well and adapting some of those procedures and mechanisms here in the States. So I'm very confident that we can find top quality facilities and physicians outside the United States.
Excellent points. And I would imagine it would be so important for a large employer as well if they're going to, modify their benefit plans, let's say a U.S. benefit plan to enable somebody to go back to their home country for care, that they're going to want them to go to the best facilities and see the best surgeons, right? Not only will that give peace of mind and comfort that the quality and the best outcome is going to be achieved, but they can also look at the financial dynamics associated with that and ensure that doing that is going to be fiscally responsible, right? As the plan sponsor, they'll actually, in many cases, save significant amounts of money, because let's face it, healthcare costs in the U.S., are not rivaled by any other first
Right.
world country around the globe.
No, exactly right.
Excellent. Jeff, thank you so much for your time. Real pleasure to speak with you, and look forward to continuing to collaborate with you as we work together to make quality healthcare accessible to everybody.
I love it. I love it. Thanks for your time this morning.